Hi, good afternoon, everyone. This is Vicky from Deep01. And Deep01 is a startup based in Taipei, Taiwan that we focus on developing AI-based solutions that apply in healthcare. And our target is to improve the healthcare quality and to help the clinician and help the patient to have a better outcome. Our solution is that our AI can detect intracranial hemorrhage, which in a simple word is brain bleeding. So after the CT scan, our deep CT can detect that whether there is a hemorrhage in the brain and then identify it. And as you can see in the screen that we identify the hemorrhage zone. This is especially helpful because that normally in the ER there's very crowded or the clinician is not available. So this AI tool will be a very quick and triage tool that help to speed up all the process in the ER. Besides showing the bleeding zone, and we also have the work list. The work list that you can see all the patient information here, and we identify that whether there's a suspect intracranial hemorrhage. That will be shown in the red and sent along to the physicians. So this changed the original order that first patient come in, the first patient first in, first out, and that will prioritize the urgent case. So if there's a patient that has a intracranial hemorrhage, that they will be prioritized and to be able to see by the doctor sooner. So why we do this tool, why we make this AI solution is that because stroke and traumatic brain injury is very common in global. Every year there's 50 million people suffer from stroke, and every year there's like 69 million people suffer from TBI. And all of these patients will require to be taken, to be scanned by CT. And brain CT is very common, it accounts for 40% of all CT scans. So wherever there's a brain CT, they will need deep CT to help them to identify intracranial hemorrhage. So the problem we solve is that we save time in critical situation, because when there is a brain situation like stroke or traumatic brain injury, there's always very urgent. So the patient arrives in the emergency room and the CT scan, and the original way will be the patient will have to wait, and especially when there is a crowdness in ER or long queue, or the physician on duty is not sure that there is bleeding or not, they will have to check different departments. All of this will take time. And our deep CT will just take only 30 seconds, and it will identify whether there's a ICH positive or negative. And if there's a positive, they will send along to the clinician, and the clinician will check first. And then, as you can see, they will change the way of how to do
Time's
it.
up. Please finish now.
Sorry?
Time's up. Please finish your speech.
Finished. Oh, sorry, it's too long. Okay. So that is what we do, and this can help the doctors and patients and hospital in many ways. So that is, and also we have FDA cleared in US and Taiwan, Thailand, and EU. So our products already has the certificates. And this will be, we already had applied in more than 10 hospitals here in Taiwan and over 20 cases. We already have global partner in Southeast Asia and Japan, and we are also developing the global market. Yeah, so that is the introduction of the Deep01. Thank you.
Thank you, Vicki. This is a great presentation. We jumped over the false positive and negative rate, but could you actually talk about what happens if you actually have a false negative?
Because our tool is to parallel to the original workflow. So it's a tool that helps the physician to have to be more confident and to have a second opinion. But after all the clinical decision would have to made by the doctors. So they will still have to check, and if there is a false negative case, they will still they will still be decided by the physicians.
Got it. So in your workflow, you're not bypassing the physician, right? So you're adding an extra.
No, yeah.
Okay. So in your opinion, because your initial value proposition was to decrease the cost of the workflow, but just by adding an extra step, you're actually increasing the total steps. Is that the right way to describe?
That is not really adding, because as you can see the work list, we have a work list, and that will, like the first triage, they will prioritize the case that has suspected ICH. So that is actually helped to do the triage in the ER. So that is not adding any burden to the physician, but this is a parallel to the current workflow.
Gotcha. And can you also speak to your business model? So are you selling a software or is it a machine?
Yeah, our product is a software, but we have two different kinds of solution. One is sell the physical server that we put our AI in the server, and we sell it to the hospital. And the other solution is the purely software, which is via the cloud. So the hospital and send the data to the cloud, and then we can do the AI to process it in the cloud. So everything can be just via cloud. So we have two different kinds of solutions. Just depends on whether what kind of solution the hospital wants.
Okay, great. Last question. So how did you develop this algorithm? Was it through kind of feeding the AI a lot of images? Can you talk through that process?
Yeah, that's the via the CNN, which is one of the most used in the image AI training. So we feed all the data and to make the AI to recognize whether it's ICH or not, and then we will verify, and then to adjust a little bit about the model. And the final result now in the clinical trial is like 98% in one of the Taiwan's most famous hospitals.
Great, thanks. That's all my questions. I don't know if anybody else.
A quick question, Vicky, thank you very much. Just further to the question on the business model, how do you see the competitive landscape for this type of product?
I'm sorry?
The competitive landscape for this type of product. Do you have competitors?
Yes, there's competitors in the US or Israel. They are we have many resources. Their funding is much more than us. So our advantage is like we use a very limited resource and to develop the product that is the same or even better than the competitors. And they focus on different things. And our focus is purely on brand. Some of the competitors, they focus on all kind of radiologist image, like chest or the anywhere. Like COVID-19 now is many companies doing the COVID-19. We don't. We just focus on the brand, because brand is the most critical situation and it's very always urgent. So we have not just the ICH detection. Actually, we have more function that is all focused on the brand to detect the abnormal of the brand. So that is our strength. And also it only takes 30 seconds to detect ICH, which is like very fast in the globally. So that is our strength, to use the limited resource and to do the same or even better than our competitors.
Thank you.
Hi, Vicky, it's Thomas Chow. I saw you had a lot of success in terms of getting some of the hospitals in Taiwan to start rolling this out. How did you originate those relationships, and will those same tools be helpful for you in terms of international expansion?
We now have a very successful development in Taiwan. That's like around 10 hospitals in Taiwan, but global market is a very different thing. We have an agent that's helping us to communicate, to do the channel here in Taiwan, and also agent that is also helping us to find a partner in the Southeast Asia and globally. So every country and even every hospital is very different. So our strategy is to find a partner local that will be helping us to communicate with the hospital locally, because everywhere is especially hospital is they have very strict rule about this kind of product. So it really has to talk and to see what's their requirements. So it's that's the difficult things. Yeah.
And what kind of economics does the agent receive for opening up the market in each jurisdiction?
I'm sorry. Could you?
What's your business arrangement with your agents? How much, is it a profit sharing arrangement or is it a fee? How does that work?
Oh yeah. Actually, they kind of represent us to develop the market locally. So that will be we sell. So they will have their revenue via selling to the hospital. So that's that we sell to the dealer, to the agent, and they sell to the hospital. And they do the service, they do the maintenance, and they do the communication with the hospital for us. Yeah.
One more minute.
Do you have existing investors? What stage are you at in terms of investors?
Last year we just closed our pre-A round that was led by ASUS. Yeah, ASUS, the very famous consumer computer company, and that was like 2.6 million. Yeah, that's the round we just closed last year. So we are now into preparing the A round. Yeah.
Thanks, sir. Thank you very much, Vicky. We are going to move you to a waiting room and move to the next startup.
Okay, thank you. Thank you, everyone, and it's very nice to see all of you.